Thank you.
Thank you for coming. It's incredibly important for us to be connected with the communities that we serve and work with, and our quality of care is only as strong as our ability to connect with all of you. We are now Maimonides Health, not just Maimonides Medical Center. And this transition is part of the transition to create access to bring care into the communities and to bring services outside the main campus so that we can meet your needs as a consumer as well as a patient. I want to give you a sense that we're also working on things, that we recognize we have challenges. And 3 areas that we're very focused on right now are access, making sure people actually get the care they need, can get appointments, are reached, that they're screened, and that they come into a culture of care. Service, so that the actual experience for a patient is comfortable and that it works for them and that they're treated, they feel the respect and the recognition of culture. And then we are in a world where we have to pay attention to finances, and the challenges are real.
We're working on room service, which we hope to offer in just a couple more months now that we've got this thing opened up, and as many food options as we can. When a patient is sick, a lot of people don't feel like eating anyway. We want to be able to give all the patients what they really want. You know, if you really want grapes, we want to be able to give you grapes. You know, whatever it is that we can provide for the patients that's going to make them comfortable and provide a nicer service for them and for their families.
We are now members of Plaintree International, which is a leading nonprofit organization on person-centered care, which will educate our workforce on empathy and compassion. In doing so, we do care, but how do we communicate caring to our patients and their loved ones? So we're having a leader kickoff tomorrow, and then we're rolling out workshops to our workforce, and that will be done on a consistent, ongoing basis.
That's who we are today, and really appreciate the support, but very much would love to field questions.
Why you cannot negotiate with the state, showing that it's not fair, that are people that are working hard and taking care of this kind of patient that need the service, that cannot afford to go to the, Manhattan.
That concept is pretty straightforward. Fairness. Why not pay us to take care of people who need care the same as other people get paid to take care of the same thing? We need to make this a priority. It's a big part of how I'm spending my time right now.
Hey, whatever issues the hospital may be facing, whether it's financial, wait time, staffing, do you attribute them all to the low Medicaid reimbursement rates, or are there any other factors?
The history of the low rates has led to a very long period of underinvestment, and that's physical facilities, that's technology.
My mother was in this hospital. She lived 2 years longer because of the staff and the doctors. She was treated better than the Queen of England. I want to say thank you. You can't forget this when you see a mom in pain, suffering, and the nurses are so dedicated. Douglas, you can call even on Shabbos. He picks up a phone when it's an emergency. I hate to tell it in public, but that's the truth. You should be proud of your staff, your nurses. It's the heart they have over here. They give their soul and their heart, and I want to say thank you.
My name is Reverend Terry Lee. Of the services that Maimonides is providing into the city, into every street and lane, so more people can come and get this quality service that Maimonides provided. And I want to say thank you.
As this group is gathered here today, what can we do as community leaders and members of the community to help their hospital?
I have a letter for you guys to sign. My signature is right here, the first signature. So please sign this to the governor. It's a plea to the governor to sustain their help to the hospital here, because this is so much needed in here, and we need the hospital and we need its presence.
All our voices need to be heard. That was asked earlier, what are we doing? And the answer is we are stronger if we all do it together, speaking up.
Douglas led me to the right doctors, and when I needed this sort of doctor, I got it here. All of my physicians are in this building, and they're keeping me strong.
I was really touched. You know, this should be on the 6:30 news to see this is really a community of people that you would think would not necessarily get along, but should get along, but they are getting along here for the good for the community. And this hospital obviously plays a strong role in that.
Thank you, Maimonides Hospital, for building great leaders, for taking people out from trauma and make them happy, peaceful, joyful nation, joyful Brooklyn. Thank you so much for everything you're offering to the community.
I just want to thank you for getting us all together. Look at us, a multicultural, multi-languages. Okay. We need the services in our community language. It doesn't matter what community, what languages we speak, we need you. We need to do more education, more workshops. And with your help, it's doable.
Very supportive that the needs are real.
Many people came back after being on respirators a long time. Here, everybody is worried. We keep them alive as long as it goes, because maybe it's going to reverse. As Maimonides used to say, as long as you keep them alive, you would have to keep them alive. And that's what happened in this hospital.
We are constantly working to improve the care we offer and our ability to reach people and create access for excellent care. Thank you for sharing your light with us. Let's go forward.